Tombi was like my father. I love my father.
There's so many more lives that is going to be lost, and so many lives that could have been saved had the right things been done and been put in place.
We are in the winter of the COVID-19 tsunami. Until July, the Western Cape was weathering the worst of it. But now, Gauteng is in the eye of the storm.
Where Gauteng is now is where we were 4 or 5 weeks ago. So they might still have a very steep incline for the next 6 weeks, and it will be quite devastating if that's what's happening in their setting.
Special Assignment recently brought you the story of nurse Ntombi Zakiti Ngidi, one of dozens of healthcare workers who died from the virus in the early months of lockdown, leaving behind her devastated and destitute family in KwaZulu-Natal. She was the second nurse to die in the Western Cape. The first was nurse Petronella Benjamin, who succumbed to the virus on the 29th of April.
I can truly say that Nellie lived her calling. She was born to purpose. She was absolutely born to do what she did. And her whole life was what she did, you know. She was a people's person. She just reached out to everybody. And everybody was her family. And I can truly tell you that she didn't treat one better or less than the other one, you know. She made everyone in her life feel special.
A pastor and a veteran nurse who managed one of Cape Town's public reproductive clinics, Nurse Benjamin died the day before she was due to retire on the 30th of April after 40 years of devoted service. Her family had urged her to retire.
And she would always tell me, Rudy, I've just got so much still to do. I was begging her already from the beginning of the year and pestering her already and said, Nelly, when? And she never gave me a date. And then, you know, maybe I think it was in February month when she said, Rudy, I've set my date. It's actually now the 30th of April will be my last day of active work as a professional nurse in the nursing field.
Nurse Benjamin had an underlying health condition, but her family says she was not sickly. She had recovered from a bout of bronchitis in early April, but although she had tested negative for COVID, her family advised her to book off sick during the final weeks leading to her retirement.
She said to me personally, Rudy, I've got another family at my work. Just as you are my family. I've got family at work, you know. And she said, I have to close that chapter in my life.
She returned to work after the Easter holidays. The following week, she began showing COVID symptoms. Her demise was swift.
After Nellie's passing, which was very, very sudden or very quick after she was diagnosed and found that she had the virus. I think it was just less than 5 days. I'm sure it was about 5 days. Then we heard that another 2 of her colleagues at the same facility contracted the virus.
Her death was followed by Nurse Ngidi's on the 7th of May. She too had an underlying condition and was working in a non-COVID ward. And there are disturbing questions regarding the protection she and her colleagues were provided with at Tygerberg Hospital where she worked.
At that time, it was not very well known what are the facts about the droplets, about the surfaces, about the transmission risks, about what is appropriate in what context. In hindsight, we probably would say to ourselves now, the risk assessment is all places where people gathered and came in, and not necessarily the identified place of the specific index case that is known to be positive.
To date, there are over 4,000 healthcare workers who have been infected, and while many have recovered, scores have died. The majority are women from struggling backgrounds. Many are breadwinners in their homes, surviving on shockingly low wages. COVID-19 has deepened their financial strain, and this new virus has exposed the old wounds of a national healthcare sector long crippled by staff shortages, incompetence and corruption. More so now under the chokehold of COVID-19.
I've seen that over the media, people saying we value our frontline workers. But in the hospitals, it's a different case. When you complain about not having proper PPE, you're not going to work, you take a stand against it, then you are being labeled as being difficult.
And I think that is important for the patient also to... Charmaine de Villiers is a veteran nursing sister in the Western Cape, specialising in critical care and infectious diseases. To her and fellow nurse Charlotte Peterson-Davids, nursing is not a job, it is a calling. Yet although both have been willing to step up to the front line in the fight against the virus, they are prevented from doing so. In 2016, both were dismissed for insubordination. And now, although legally they can be readmitted to the public health sector, they have in effect been blacklisted by the very hospitals that could benefit from their dedication and expertise.
Say for instance, I apply at Grooteskier. Then what they would do, they would, check my references, check my ID, and then they would, I think if they see my Persal number, that's your specific personal number, then next to my name would come up dismissed. Then people would just, they won't get back to you.
Both nurses have been surviving getting freelance work at private hospitals, but without the occupational safety and health benefits accrued to health workers in the public health sector should they get infected by COVID-19.
I do feel unsafe, even though there's enough PPE. There's not enough staff. They are stretched to the limit. You have to work with a ventilator and with another patient, maybe on a face mask, on oxygen.
Her fears echo those of thousands of healthcare workers who complain of victimization should they speak out.
Intimidation, bullying and victimization, I will say it loudly because this is what is happening. If you disagree with what is happening, then they see to it that they get to you.
They are so scared of speaking out because the minute they speak out, then they speak against their employer. And then it warrants for a disciplinary action to be taken. I think it's similar across the country. I do think that the people that are appointed in positions that should look after the well-being of staff are not doing a very good job.
The pandemic requires an economic response that is equal to the scale of the disruption it is causing.
On the 21st of April, President Cyril Ramaphosa announced a COVID-19 social and economic support package of 500 billion rand, amounting to approximately 10% of the GDP.
We are now embarking on the second phase of our economic response to stabilize the economy, address the extreme decline in supply and demand, and to protect jobs.
But the economic relief package excluded the hundreds of thousands of underpaid nurses, cleaners, porters, emergency response teams, community healthcare workers, and other essential frontline workers. Yet in countries like Ghana, nurses have been exempted from paying taxes for 3 months and given an additional allowance of 50% of their basic salary.
Every nurse should be compensated during this period, whether they work in a medical ward where the patients were tested and they tested negative, whether they work in the PUI unit, patients under investigation, whether they work in the positive COVID units. Every nurse must be compensated.
South Africa's Disaster Management Act makes special provision for healthcare workers to claim compensation through the Occupational Safety and Health Act of 1993 if they contracted the virus at work. The Compensation for Occupational Injuries and Diseases Act, or COIDA, is central to their rights and recourse to compensation.
Occupational health and safety is a central pillar that has now come to the fore because, as you rightfully explained, we've had to really get into a place, and I think we are in a good place, of having put occupational health and safety central to this thing, where both staff and managers are understanding and embracing the importance of doing occupational health and safety to its full.
But the devil is always in the detail. According to the Occupational Safety and Health Act, the primary responsibility for the health and safety of employees is placed on the employer. The employer is legally obliged to provide a working environment that is safe and without the risk to the health of employees. This entails adequate risk assessments, management, and measures to prevent the spread of the virus in the workplace. The Western Cape Health Department insists it followed a thorough clinical risk assessment, identifying and containing COVID hotspots, but that it couldn't anticipate all the spaces where the virus breeds and spreads.
While we were looking at the clinical spaces, COVID was happening in the admin spaces, or in the kitchen, or on the way to work, or on the way from work, or to the shop. Or actually when people were just in their unguarded moment having a cup of tea together, when they were away from the patient. That's all the places where it was. It's taking that seriously to a community scale.
It's difficult to control the social environment in which people are, but it's easy to control the hospital environment. And there's a responsibility on the employer to control that virus, the environment in such a way that we literally eradicate the possibility of a person contracting the virus totally. Is it fair on the employer? I would say yes.
The family of Nurse Benjamin alleged that at the reproductive clinic where she worked, there were no risk assessments and no measures to protect staff against infection.
I can state quite categorically and unequivocally to you that that risk assessment was never done on Petronella, because she verbalized that to the family when the question was asked to her, did they do a risk assessment on you when you returned back to work after you were sick with the flu? It was not done.
They alleged that it was only after Nurse Benjamin's death and the infection of several colleagues that the clinic was shut for deep cleaning and protection intervention measures were implemented. Several colleagues at the clinic confirmed that in early April there were few, if any, prevention and protection protocols in place.
Subsequent to people starting to get sick and people started to die, and then there was this uproar and things being put in place and the nurses wanting to go on strike and all this thing. This was post the original period of lockdown.
Not, the only one of its kind in this municipality. It's particularly over the issue of PPEs and the lack of testing, particularly among staff members from the Department of Health.
In addition to protest action, during the first week of lockdown, labour unions launched a lawsuit against the National Department of Health. They alleged that at public health hospitals and clinics, there was insufficient prevention and detection measures, as well as a severe shortage of personal protective equipment. The judge ruled against the complainants.
The Labour Court found that there was no legal or evidentiary basis for Nahau's case. What they said was Nahau had failed to establish that the minister had failed to provide PPE and guidelines regarding its use as it was alleged by Nahau. And on that basis, the application was unsuccessful.
But Nurse Benjamin's family is demanding answers.
There was actually a request from the family to her employers, Nelly's employers, as to if the actual risk assessment was done. Till this point, there was no communication back to the family, no documentation given, nothing as to that we had a risk assessment in place or we did not have a risk assessment in place.
The Western Cape Health Department denies receiving any grievance or request from the Benjamin family regarding the presence or absence of risk assessments at the clinic where she worked. Healthcare workers also claim that with the vast footprint of COVID infections outside the immediate clinical environment, it is convenient for the employer to pass the buck of responsibility to the employee.
The department reneged responsibility immediately by saying she did not contract the virus in the workplace.
This is allegedly what the Department of Health attempted to do after the death of Nurse Benjamin. The reproductive clinic where she worked is located in the Golden Acre shopping mall in the heart of Cape Town's bustling CBD and intersected by major transit routes via bus, taxi and train. The media statement released by the Health Department after her demise states emphatically that she did not contract the virus at work, suggesting that she could have contracted it in her community or even at home.
That, I tell you today, was a blatant lie.
How many trains with people have to stop there? These were the shops where there were people that had to close because there were staff that were positive. Now, who's not to say that that same people visited her? There was nobody that said, you must screen people, you must check for this, check for that. So she treated patients on what she saw in front of her. Now, how can you say that she did not contract it there and in the workplace?
Go and wash hands.
According to the Occupational Safety and Health Act, employees have the right to lodge a grievance if they believe health protocols have been violated in the workplace and to refuse to work in an unsafe environment.
You have to speak up and you have to stand up and refuse to test patients or work with patients if you are not there's not satisfactory PPE, not even satisfactory full PPE. I have to work in a safe environment, I have to protect myself and I have to protect my patient.
But they say they are threatened with disciplinary action, even dismissal if they do so.
They are now actually issued people with an oude alterum partem notice to say, respond why you didn't want to work. They know why people didn't want to work. People were worried that they were infected. People don't understand. They don't deal with the people's fears. Now they come and say, this is our policy. It doesn't comply with the world standard. How can you say that you are a responsible employer?
If frontline workers believe that they are not being given the protections that they're entitled to, I would argue that they have obligations to come forward under the Occupational Health and Safety Act. They must come forward because the Department of Health, the government, the regulators that are overseeing these pieces of legislation can only work with the information they have.
So same applies. If at your workplace this does not happen.
As well as compensating healthcare workers who are infected from COVID at work, the Compensation for Occupational Injuries and Disease Act, or COIDA, also provides compensation for trauma experienced at or from the workplace. But lodging a claim is a long and bureaucratic process.
Proactively, a team of people, wonderful people in our human resource department, actually built relationships with the commissioner in this period of time and started processing all the paperwork, processing all the information they require, so that the processes at the commissioner can also be quick and there's completion and finality in terms of what we can go back to the family.
But COIDA also shields the employer from liability for compensation claims and places responsibility at the door of the Labour Department's Compensation Commissioner. And the onus is on the employee to justify the claim.
What you have to do is, in terms of the claim, you have to express yourself on your certainty of where this happened, because the commissioner has to make that call. The commissioner has to get the information to say, on what basis do I make the claim?
But how does the commissioner determine whether the healthcare worker contracted the virus at work or not?
On a balance of probability, if I am at a hospital that is treating COVID-19 patients and I am the receptionist, I have a risk of occupationally acquired COVID-19. If I am the person testing the temperature at the outpatients, I have a risk. If I am the person cleaning the floors, I also have a risk. I do not believe that we can say that you can only acquire the COIDA benefit or the occupationally acquired COVID-19 benefits if you were in direct contact with a person tested positive for COVID-19. That would be an incredibly high onus of proof.
And what recourse is there for bereaved families of nurses who allegedly died due to willful negligence by the employer? In the case of nurse Ntombi Zakiti Ngidi, for example, her colleagues say she was not adequately protected, and more than a week before she died, her own WhatsApp messages suggest that she was forced to work when she should have been placed in isolation.
She worked while she was supposed to be in isolation. And that is scary.
And what about Nurse Benjamin, whose family and colleagues allege that at the reproductive clinic where she was working during those early weeks, there was no risk assessment, screening, or PPE as stipulated by law?
If we're talking about a fatality, there will be an investigation at this point, and the employer would have to produce evidence that it has complied with those statutory obligations, the safe and healthy working conditions, the comorbidities, the ventilation, the PPE, etc. If you want to bring a claim that that was not done, you would need to prove that you complied with your reporting mechanisms and escalated that to bring a claim.
The Western Cape Health Department insists it has learned valuable lessons from the pandemic.
One big lesson in this province is how seriously we should take occupational health and safety going forward, because it is ultimately vital for us to look after the health and well-being of our staff.
Indeed, in the Western Cape, there are now strict protocols at hospital and full PPE for staff working in high-risk zones. Even at the reproductive clinic where Nurse Benjamin worked, screening protocols are in place, and the department has acknowledged the importance of providing greater support to all healthcare workers.
It's about equipping frontline managers as much as frontline staff to have meaningful engagements, around what we call relational power rather than positional power.
But for bereaved families, the emotional wounds are still raw. Nurse Benjamin's husband nearly died from COVID-19 as well. The trauma has taken its toll on her daughter, Alicia Mart, who has followed in her mother's nursing footsteps.
Edwin came through it. Nellie's husband came through it. He was very sick at one point in time. I mean, we really thought we were going to lose him and we were going to have another funeral immediately after Nellie's funeral. He pulled through. Alicia now at this very moment is a big concern for us. I spoke to her on the phone. I spoke to her I heard her on WhatsApp, and I'm terrified at what Alicia's going through.
The day Nurse Petronella Benjamin, or Aunt Nellie as she was fondly called, was buried, a guard of honor was held by her colleagues, family, friends, and former patients along Forest Drive in the suburb of Easter River, where she lived and died the day before the beginning of her golden years.
We can actually take this battle to the next level and make sure that the legacy of Nellie will actually incorporate saving lives from now going into the future. Yes, we need to be more vocal, and yes, we need to stand up more, because this thing is far from over. We didn't even reach the peak of the mountain yet. And there's so many more lives that is going to be lost and at stake. And so many lives that could have been saved had the right things been done and being put in place from day one.